I'm Polly Warren and welcome to the Positive Perimenopause podcast. This is the place for some positive inspiration to help you through the rollercoaster ride of perimenopause. I truly believe that with the right support, knowledge and wellness tools, you can feel your best yet, because I'm learning this life phase can be a truly exciting and often pivotal time of life. With every episode, my mission is to support and empower you to own your menopause, because it's time to start taking care of the most important person, and yes, that's you. So thank you for being here and sharing your time with me. Now let's dive in. Hello and welcome to another episode of the Positive Perimenopause podcast with me, Polly. How are you doing? So as I record this, it is really very cold here in the UK. It's about 0 degrees. We've got snow outside, which down here in Brighton is very, very uncommon as we live by the sea and we're kind of right south of the UK. But the snow outside and it feels so Christmassy. I'm really, really loving it. Although at the end of this week, I and my whole family are off to Jamaica for Christmas. I'm so excited. And I looked at the weather today and it's 31 degrees and really sunny. So I couldn't get to opposite temperatures. So I'm really, really looking forward to that. And that means that for the next 2 weeks, I'm going to have a podcast break. I won't be releasing any new episodes for 2 weeks because I feel that we could all do a break over Christmas. And actually, I'm very proud of myself that I've managed to put out an episode every single week since the beginning of May. And I just want to say a huge thank you for listening and inspiring me to keep putting this podcast out there, because I'm still getting so many lovely comments from you and my download figures seem to be constantly increasing. So thank you so much. I am so grateful for you to be listening. Now, did you listen to last week's episode with Annie Nakvi? If you didn't, I really recommend going and having a listen. Her story is truly amazing and she is so inspirational. She was a tsunami survivor back in the Asian 2004 tsunami, and she really is using that experience now and all the trauma which obviously it brought her. She's kind of now using it to help other people. And I absolutely love that conversation. Okay, let's talk about this week's episode. Now, this week's episode is all about pelvic health. Now, so many of us accept that when we laugh or when we sneeze, that it's normal to have a little wee or let a little bit of a wee come out. I'm sorry, I know it's a little bit embarrassing or probably not something you really want to think about, but it happens to so many of us. I mean, I know for me, activities such as trampolining are very much not an option for me anymore. I did have 3 big babies, but what I have discovered is that these issues don't just affect women who've had babies, it affects everybody. And particularly as we go through perimenopause, because of lower estrogen levels, these issues can get worse. So it's really important that we know what is going on and some of the things which can be very simple, which we can do about it. We might also find that we need to go for a wee in the night more than we ever used to, or but we just need to wee more. My kids are constantly taking the piss out of me because I'm constantly needing to have a wee. And I know it can be really embarrassing sometimes and awkward to talk about. Or for many of us, it's also can be a matter where we just sort of laugh it off. We joke about it. We just think it's part of life. But it can become a real problem if we ignore it. So I was delighted this week to talk to specialist women's and pelvic health physiotherapist, Suzanne Vernazza. Now, Suzanne is passionate about improving care in this really important but often neglected and not talked about area. She has her own pelvic health physiotherapy practice here in the UK, but she has also grown a really massive TikTok following of over 500,000. not only on in TikTok and also on Instagram is she highlighting the importance of pelvic health, but she also does loads of brilliant demonstrations and videos, which she calls squeeze-alongs, which show you how to do really good pelvic floor exercises. So you can literally squeeze along to the video. So I really recommend listening to this conversation. I definitely learned a lot. It's definitely encouraged me to really do more pelvic health exercises, and I hope it will do for you as well. So without further ado, please welcome the brilliant Suzanne Vernazza. Hello, Suzanne. Thank you so much for joining me today. I am very much looking forward to this conversation. So thank you.
Thank you for inviting me. I'm really, really excited too.
Obviously, this conversation about pelvic health, about urinary stress or urinary incontinence is not a glamorous one, but I do feel it's a really, really important conversation, because I think particularly as we age, particularly as we go through perimenopause and into menopause, so many women find that there are changes, particularly in their bladders or in their pelvis. And so we need to know and be aware of what is going on. So I suppose where I want to start is, personally, I know that I'm not able, for example, to jump up and down on a trampoline anymore, because I know that I will wet myself. And it's a weird one, isn't it? Because I can talk about it and sort of laugh it off. And I do this with my friends. And yet I know it is not normal, and I know it's not a good thing. So I'm really interested to find out more from you. Right, what is going on? Why is it happening? Let's start off with, what's going on and why is it happening?
So this type of leakage is really, really common. And actually, because it's so common, it's something that gets quite often normalized, that, you've had babies or you're getting older. Of course, if you sneeze, laugh, if you jump, you're going to leak a little bit of urine. And it's called stress incontinence. And everybody, well, not everybody, but a lot of people, when you say to them, it's stress incontinence, they, well, it's not anything to do with stress. But actually what that stress means is when you cough and sneeze, your bladder is under a little bit of stress at that point, and that's when the leak will happen. It's the most, I suppose, common form of leakage we associate with childbirth, and it's actually really, really treatable. For about 70% of women, it can improve just with pelvic floor exercises. But there are also that other 30% of people who won't get that improvement with just pelvic floor exercises. And that's possibly where they may need something else. So the reason it kind of happens where it's your pelvic floor is that your pelvic floor is the muscles that sit at the base of your pelvis. I often think of them a bit like a tap at the end of a hose. They provide that closure support for when you cough, you sneeze, and they also feed back to your bladder and say, no, we're not near a toilet. We need to not be doing that now. So the two work together. So if you've got a slightly loosened tap, you'll get drips that happen. And so that's why the pelvic floor can then sometimes help by lifting up. Now, if you've had very big babies, if you do a lot of coughing because you've got like an issue with your chest, your respiratory system, or if you've been doing lots of heavy lifting, if you're constipated, there's a lot of down pressure that happens, and that can then predispose you to even more leaks. So you don't have to have had a baby to have stress incontinence. It can happen at any point. And of course, when you hit perimenopause, we understand now that a lot of our hormones impact how our bladder works and even how our pelvic floor works. So you'll often find leaks that were probably controllable get worse around the perimenopause. And then it's really about trying to look at some of the things that can help with that. So the reasons it happen are generally the weakness of your pelvic floor, or a change in the position of your bladder, or just hormonal changes. So there are a few different things. And the things that you can do, the first thing I would say is try doing pelvic floor exercises. It's really hard, isn't it? I don't know, because they're so boring, pelvic floor exercises. And actually, we often told, off we go and do them. I know myself, because I had stress incontinence after my children, and I wasn't great at doing them. And I'm a pelvic health physio, so I completely get that they're just not the first thing that you think of doing. But it's unbelievable how actually doing something really regular can help. And even what I'm finding with the Know Your Flaws squeeze-alongs that I do is that people, because they're adhering to them a bit more, within a couple of weeks, they're actually noticing a change, and actually stopping those leaks a little bit. So, but it's hard because then you want to get onto a trampoline. If you want to get onto a trampoline, that can take a little bit longer. It can take a few months of consistent exercise. And what do we know happens in like 6 months? You go on holiday, you get on well, you have poorly children, you have work. It just gets knocked. It's not that important. If you've got a very small leak, you probably, you can get away with hiding it, can't you?
Yeah. 70% of women can improve, which is so hopeful and such good news. I think that is brilliant. And you can do it with pelvic floor exercises. I know that, I had 3 very big babies, all over 9 pounds, my babies were. And and I was really good at doing pelvic floor exercises. If I was standing in a queue, if I would really make a big thing of him. But I think it's definitely kind of not been on my radar for many years. My children now are much more, grown up a bit. Is it something that you need just to keep doing forever?
Yeah, although saying that, if you stop for a while and you go back to them, you'll still get those benefits again. So, because often people are like, well, it's too late, I'm not going to be able to change my muscles. Actually, you look at some of these as, inspirational older ladies who are in gymnastics and various things like this, like in their 90s, and they didn't start till they were in their 70s. It is always possible to change, because actually in our lives, our priorities are constantly changing. And if you haven't had chance to be really consistent with your exercises, don't worry, because there does become a time and a place in your life that you think, right, I'm going to do this now. I am now back at the top of that list. I've been at the bottom for a while because I've been looking after my family, but actually it's never too late to start to make that change. And if you've tried them before and they've helped and they've just slipped again, then, be rest assured that you'll get that benefit by re-instigating the exercises.
Okay, so how does one go about doing a really good pelvic floor exercise? I love your squeeze alongs, and I and we will share your details so that everyone can go and have a look, because they are brilliant. But maybe you could just explain to the listeners how we can do some really good pelvic floor exercises.
So the common problem that a lot of people do is they try too hard. It is a very subtle exercise. The best way to imagine you doing it, because your muscle is a little bit stronger at the back, is imagining holding wind in. So I often say to people, imagine you're in a lift and you're like, uh-oh, and you really just need to hold that in. You don't want your bum cheeks going. It is literally just your back passage or your bum hole, if we put it crudely. But essentially, if you think about holding wind in and then trying to imagine lifting up and forwards as if you're holding wee in as well, that's kind of where you want to be working. If you are getting your eyebrows going, your tummy muscles going, everything going, it's likely you're doing it wrong. And that's where it becomes really hard. For men, it's much easier for them to see what they're doing because they get a visual, they get movement on the outside. Whereas women, it's all on the internal side, so we can't see what's happening. So if you're not sure if you're doing it right, if you're seeing an active movement when you're on the outside, it's probably worth having a look with a mirror if you feel that you can do that. Again, for some people, that just triggers memories of bad childbirth and things like that, or they just might not want to. But if you can have a look, because it's quite good to check your skin at the same time and check for any changes that are happening down there. But what you should see is your back passage should close upwards, your vaginal entrance should close, and so you should see an upwards lift. If you have something like a prolapse, which again is common, they rear their heads a bit more around perimenopause and menopause, but again, you should see that move internally. It shouldn't be pushing down. So that can give you an idea if you're doing it right or wrong. And then if you're not sure, even with that, or if you've been doing pelvic floor exercises for a while and they're either not making it better or you're actually finding things are getting worse, it's worthwhile popping and seeing either your GP, a bladder and bowel nurse, or a pelvic health physio. And that's our bread and butter as pelvic health physios, is we will assess your muscles. It's usually an internal examination. Some people use ultrasound, but we'll guide you very, very quickly as to whether you're doing it right or wrong, and then give you an individualized program. So that's how to do them.
So how long are you meant to be squeezing for?
So this is an interesting question, really. There is a little bit of evidence base, and it's looked at doing squeezing and holding for 10 seconds. And the aim is to do 10 of those and then 10 quick ones where you go up and down. Now, I often say to people, the evidence base is based on that kind of program of work, but we've never really looked at different, well, some people have. We looked at doing just 100 squeezes. But if you think of any other muscle in your body, you wouldn't just go to the gym and do a squat, hold it for 10 and come up and do 10 of those, and then 10 squats up and down. You would modify it depending on what you need. So I would say the general guidance is do 10 long holds and 10 quick squeezes 3 times a day. However, if that's really difficult, start at whatever level you can manage. If that's really easy, you might want to do it in standing, make it a bit harder, or you might actually want to look at putting it into something like function where you're doing something in like an in squat position and doing some pelvic floors there. So everyone is different is the answer. And yeah, we say 10 lots of 10 and 10 quick ones as a basis, but it probably needs modifying for what you need.
Okay, fantastic. All right. So as we hit perimenopause, it's the lowering of estrogen, which does affect, is it the lining?
It affects everything
Okay.
because we have estrogen receptors all the way through our bodies, and that's included in our bladders, including in the vaginal tract. It's everywhere. And if you think of your skin, as you're going through perimenopause, your skin becomes thinner, and quite often vaginally the same thing happens. So you'll hear in the medical world, you'll hear things like vaginal atrophy being bandied about a lot. And that is, it's quite a scary word, a bit like prolapse is quite a scary word, but it's essentially thinning of the vaginal tissue. It becomes drier and it can become a little bit sore, and that won't then support your bladder or your pelvic organs particularly well. So it can make everything feel a little bit lower down. And that's generally one of the biggest things that happens that is mostly noticeable. So it can really affect your intimacies and how comfortable you are wearing knickers, all sorts of things. But surprisingly enough, using something very simple like a local vaginal estrogen from the doctor is low risk and can really help with bladder leaks and lifting everything up and plumping your tissues and make it less dry. So that might be something worthwhile exploring if anybody's struggling with it or hasn't tried it, because it was something that we were worried about, but actually it's quite low in terms of its risk factors for using a HRT.
Yeah, and it's very, very topical. It's just, you just put it on the area. And I'm pretty sure now you can pretty much buy it over the counter, I think.
Possibly. I know there has been talks about it, but again, if you're struggling, because there are different ways of administering it, so you can have it as a pessary, like a tablet that you put vaginally, there's creams, there's gels, and there's even an S-string that you can put vaginally that stays there and just does topical estrogen, and it stays put for a certain amount of time. So ask your GP if you're not sure.
Okay. I do want to talk about prolapse in a bit, because I must admit that word totally terrifies me. But before that, is needing to wee more frequently part of this whole stress incontinence? Is it the same thing?
It's slightly different. So stress incontinence is that leakage with the cough and the sneeze, but the needing to go for a wee and that urgency when you need to have a wee, that's a slightly separate thing. And you can have both together, which is called mixed incontinence, but you can have just either urgency on its own where you hop to the toilet and you can try and get there really quickly. But you can have leakage associated with that. And that's either known as an overactive bladder or urinary urge incontinence. And the mechanisms for them are slightly different. So if you have got that, it can be, again, weakness of the pelvic floor. It can be because your bladder's sat a little bit lower, or it's because of the estrogen change. But sometimes it's because your bladder's working a little bit too hard. So sometimes I have to give you bladder medications to try and calm your bladder down a little bit, or use bladder retraining, looking at what you're putting into the system, because a lot of perimenopausal women will find that their tolerance for caffeine and things like that seems to change, and your bladder tends to find caffeine very irritating. So if you then have that increased sensitivity because you're perimenopausal, you may well find your bladder shouting at you more. So alcohol, caffeine, acidic foods, all of those type of things can then to start to irritate your bladder more than they would have done before. So it's looking at what you're putting in and possibly modifying that and seeing if that improves your bladder as well.
A very quick break to ask you to hit the follow or subscribe button if you haven't already. And if you're enjoying this episode, I'd be super grateful if you could hit those stars and rate it too. Thank you. Yeah, because I mean, it is one thing I do an awful lot of. My kids are constantly taking the mick out of me. Oh, mum's having another wee, because I'm constantly needing to have a wee. And particularly also in the middle of the night. Now I can't seem to go throughout the whole night. So will pelvic floor exercises help with that as well?
They
Generally.
may, but to be fair, one of the things I think, and that's where a pelvic health physio comes in, we'll screen all of those things and go through, well, actually, is it your pelvic floor? Because the pelvic floor does get blamed for a lot, and it's actually not always that. Sometimes it is looking at what you're putting in and out. Because the other thing is there's quite a big phase for drinking a lot at the moment. So people are like, right, I really need to up my water intake. But actually, our bladders sometimes don't like huge amount of fluid. So a good starting point is thinking about total fluid intake, if you're not sweating lots, is about 1.5 litres a day. And that includes all of your drinks, your teas, your coffees, your water, everything. Because what we'll often find, people come into clinic and they've got a 3-litre bottle, plus they're having tea and coffee, and then they're up in the night. And actually starting to reduce that down can make a big difference. So it's worthwhile looking at those things.
That's so interesting, isn't it? Because that goes against everything which we're told. We should be drinking at least more than 2 litres. And I mean, I definitely noticed that if I don't really tend to drink anything after sort of 7 o'clock, 8 o'clock at night. And it does definitely help. But yes, that's really interesting.
Yeah, it's hard because, again, the evidence base for how much we drink comes from studies taken many, many years ago, but they're based on people in a temperate environment. So it's really hard. And again, if you go and see somebody like myself who will say, right, what are you drinking? Sometimes we look at a bladder diary and we look at what comes out. And actually, to be medically hydrated, you need to be passing a certain amount. So we'll look at that. A good indicator for you as yourself is to look at the colour of your urine. And if it's really, really pale all of the time, then you're probably drinking too much, because you've got to remember you also get fluid from your food. So if you have soups, if you have cereal, you have fruit and veg, they're very water-based. So it's worthwhile looking at your urine. It should be a straw colour. Of course, in the morning, it's usually stronger, and that's fine. But, it's listening to what your body says and taking the general information and applying it to what you need.
Okay, thank you. All right, well, let's think about then prolapse. So I'm aware of prolapse because I've had a member of my family who had a really horrible experience with a prolapse. I wonder, Suzanne, if you can just tell us, what is a prolapse and why do they happen? Because they do sound a bit scary.
They do. And I have to admit myself, I was really scared of having a prolapse before I had my children, because as a physio, I'd been made aware of them. And actually, I think that probably quite rightly it made my pregnancies and my labours much more difficult because I was worried about them. But now I know more about them. They're not actually as scary as you think. The thought of things falling out is never good. But essentially what a prolapse is a downward motion of one of your pelvic organs. So it could be your bladder, it could be the bowel, and it could be the uterus. And you can have any one of the three or a mix of them. Now, what I always say to women is that we are designed to give birth, and we are born with everything really high up, knowing that there will be some downwards movement with gravity. We are all being affected by gravity. And so to some extent, a prolapse and a downward movement is what is expected for our bodies. However, for some people, they can sit too low and they can cause problems. And it's when it gets to that point that we need to do something about it. And there is loads and loads that you can do to prevent, to manage, and then treat prolapse symptoms. I think because they're quite scary and not really spoken about, I think you could quite easily sit in your own head thinking I'm the only person this is happening to. But if I give you an idea of numbers, it's half of women immediately postnatally will feel some feeling of a prolapse. That usually massively improves. But then once you get to the perimenopausal age, half of women, whether they've had a vaginal delivery or not, will have a prolapse. So if half of the population of women are having them, how come we don't talk about them more?
Yeah.
And also that also makes you think that, do you know what, if half of us are having them, it is most likely not normal, but expected to some extent. And actually, if you can be aware that you are either prone to a prolapse and do all the right things, you may well be able to prevent having problems in your later life.
Okay, so what can we do to prevent?
Well, exactly. So this is the thing. So working out what your risk factor is. So we talk about risk factors for lots of things like diabetes and heart conditions, but it's the same for your pelvic health. So we commonly think childbirth is the only reason you might get prolapse, but it isn't. It is one risk factor. So if you are overweight for a lot of your life, that increases your risk. If you've had an assisted delivery or heavy babies, you are at greater risk. If you have family history, so if your mum, your sister, your grandma has had a prolapse, again, we think it's to do with your collagen makeup. You're just more prone to get one. It doesn't mean you will, but you might be more likely to get one. If you have chest infections, constantly problems with asthma and lots of heavy coughing, or you do lots of heavy lifting, again, that increases your risk. And constipation is a big one as well. So if you're somebody who suffers with constipation and you're pushing down an awful lot, a lot of the time, again, that increases your risk. Now, if you have multitude of those things going on, that would suggest that possibly you are higher risk of having a prolapse. But again, everyone's different. So some people will live out there with all of those conditions and not have a prolapse. But if you know that you are somebody with those risk factors, what you want to try and do is, first of all, manage the things you can change, because we can't manage everything, can we? We can't change what type of baby we're going to have or possibly change the way we're going to deliver, but we can change constipation. We can keep a good, healthy weight. Now, interestingly, if you lose a lot of weight, some women will find that they then feel a prolapse because fat also lifts the prolapse up. But if you can keep a good, healthy weight, look at what you're lifting and how you're lifting, and if you get recurrent coughs, is managing that really well with your doctor. Actually, some of those things can really, really help, because you're not going to change your genetics either. We're kind of born with whatever we're born with. It's just looking after ourselves, isn't it?
Yeah.
So
Okay.
yeah, so they're the main things. And pelvic floor exercises, of course, is really important. Trying to just encourage everything to stay as fit and and that's from before you have children, if you can.
Yeah, okay, that's really good to know. And if, however, you do notice things are changing and you kind of suspect that you might be having a prolapse, what steps do you take? What do you need to do?
Yeah, so looking around at the evidence base and the information out there. There's lots of people talking about prolapse now, which is better. The profession I work under, there's a website called the POGP, which again I can send you the details for, and they've got leaflets about prolapse, which talks through all of the things that you can do and just to try and treat it and manage it. What I often say to people is, think of it a bit like an onion, because if you can get your lifestyle things sorted out, like your constipation and your lifting and your pelvic floor, you'll get an idea whether that prolapse will go back up a little bit, because you can get improvement just with those things. And then it's about maintaining those lifelong, if you can, or with the obvious wobbles that we all have with life. Yep. But if you can manage that, that's great. For where it becomes past that point, that you've got those lifestyle changes in place, but it's still not quite enough to manage a prolapse, there are lots of other things. So there's things called pessaries, which can be popped vaginally, and I describe them a bit like bra for your nether regions, essentially. It's a support unit that can help a lot of people try to manage the bladder, the bowel. Not so good for the bowel, but there are a few different types that you can use that a gynecologist or your GP can help with. Estrogen, local estrogen, again, can help to lift things up. And then failing that, there are surgeries that can be done to help lift. But I always say to anyone who's going through surgery, it's really important you get those lifestyle and the pelvic floor things done to try and support that surgery. So it's worthwhile doing all of those things first, so that by the time you come to surgery, if you need it, you're actually going to do really well and hopefully not have any issues afterwards.
So really, it does feel like it's a real prevention thing which everybody needs to know more about. Everybody needs to
Yeah.
be doing their pelvic floor, and particularly, well, before perimenopause really, but particularly at perimenopause, whether you've had a child or not, but particularly as well if you've had a child.
Yeah, and it's hard because it doesn't get spoken about. You'll go to a gym class and, you know, they'll do lots of things, right? Let's get your bum muscles, or, you know, you do the whole host of your body muscles, bar quite often your pelvic floor. And that's the bit that gets ignored. And most people will continue to run and exercise with maybe pads, or they'll stop because it feels uncomfortable, or they'll get a pushing down heaviness feeling. But if you are getting any of those, there is loads you can do, and it's just about modifying it for you. So go and see someone is probably my biggest message.
Yeah.
Don't be afraid to ask the question, or, you know, it's hard going to the doctor for embarrassing situations, isn't it, when you don't want to talk about it? But it's definitely worthwhile sorting out, because it changes your quality of life massively.
Absolutely. Yoga is really good though for pelvic floor, isn't it? Because we always talk about the mula bandha and pulling that in, and I mean, that's really helpful. I think that is where I first learned about the pelvic floor. And sometimes though, it's quite difficult to relax the pelvic floor.
Yeah.
Is that a thing? Because
it's massively a thing. Yes. And that's probably where we get that the 70% get better, but the 30% don't. Some of it is overactivity and overworking your pelvic floor. So that's the other reason that I caveat and say, if you're not getting better with pelvic floor exercises, please go and see someone. And I think more and more as a clinician, when I'm assessing people's pelvic floor, I'm seeing overactivity, which is when I get them to squeeze, they're already squeezing. And it's because life is so stressful that you probably find that during the day, you hold tone in your pelvic floor. You know, we're starting to link, jaw clenching and teeth grinding with overactivity of the pelvic floor. So yes, I think if you struggle to identify where your pelvic floor is to squeeze it, it may well be because actually, first of all, you were already squeezing and you need to work on the relaxation part. And so that's why I've done a few things on the squeeze along, where we look at just literally the breath and getting your pelvic floor to relax, because there's more and more people that need that than there is probably the squeeze sometimes.
And I presume that is through breath work, it's through relaxation.
Which is perfect in yoga, exactly, because your diaphragm and your pelvic floor work like a piston. So as you breathe in, your diaphragm lowers, but so does your pelvic floor. So if you can use your diaphragm to encourage that, and you've got an overactive pelvic floor, that can massively help. But it's not easy. It's easier to squeeze than it is sometimes for people to let go.
Yeah. Is there anything else, Suzanne, which we've not discussed, which you think is important for somebody to know about their pelvic health?
I think the most important thing to take away from it is that it's never too late to ask for help with something. I have been there and think, oh God, I don't want to be doing all these lifestyle things. Like, I've got so many other things. Just shelf it until you feel you're in a good place to prioritize yourself. That is fine. Don't give yourself a hard time. But when you can and you feel like you're ready to prioritize yourself again, please go and see somebody, and just even raise it with your GP, and ask to be referred to see somebody, because there is help out there.
Fantastic. I normally ask all my guests at the end for one take-home practical tip which can help them have a positive perimenopause, and I'm presuming that was it.
Yeah. Yes.
So I don't need to ask you that question. So thank you so much, Suzanne. It's been really lovely to talk to you.
My pleasure entirely.
I think everyone needs to come and follow you on Instagram, and you've got a huge following on TikTok as well, haven't you?
No, it's gone a little bit crazy. I think I've hit 500,000 now, which is unbelievable, but It's great because it's getting the message out there. So I'll just keep making an idiot of myself on TikTok for a while.
Oh, well done. It's absolutely brilliant, the work you're doing. And yes, everyone should come and follow you. I'll put all your links in the show notes. And thank you so much. So yes, definitely go and follow Suzanne either on Instagram or TikTok. She's at Know Your Flaws, and you can go and squeeze along with her, and it just makes it so much easier to do. Right, that is it for 2022. And if you have enjoyed listening to this podcast, honestly, it would be the best Christmas present ever if you could go over to Apple Podcasts and leave me a review, because it really does help get this podcast out there. Have a fantastic Christmas, whatever you are doing. I know some people might be working, you might be with your family, you might not have family, whatever you are doing. Just remember, take some time for yourself. You are the most important person, because unless you're firing on all cylinders, it's very hard to give to the ones that you love. Have an amazing Christmas, and I can't wait to see you back in the first week of January. Bye.